Hello and welcome to the Mental Health Recovery and Resiliency Principles and Practices training with Mary Jedwisiak. This is a live training that was filmed on May 26, 2010 in Vancouver, Washington. If you'd like information about other trainings and services offered by Mary Jedwisiak, please visit our website at www.matac.net. This is a 4-module training and you're watching Module 2. We begin this module with small group and large group discussions on the handout, Here's Jim. The recovery components of self-direction, empowerment, and non-linear will be discussed. And finally, we'll hear 3 people tell their personal stories of recovery.
What I see is the lack of communication with the provider. The provider's not listening to Jim, so that,
He's pretty clear about what he wants. And then when he tells them what he wants, instead of saying, oh, let's explore that, they're like, no, don't think so. He's argumentative and, documenting that he's not being compliant. It's just like, doesn't really work.
And also, it seems to be focused on medication only. They don't seem to bring in any other help for him or solutions for him, but it's all about the medication.
That's it. It's all about the problems and not about the solutions. I mean, there's no connection between his feelings of feeling dead inside and the nature of his marginal existence, which seems to me an obvious connection. If they want to make him feel less dead inside, they have to make him feel less marginal.
Well, he must have something together because he has a bachelor's degree. I mean, we don't know what in, but to have completed a bachelor degree, he's got something going for him, and building on that, whatever that might provide for a skill, would be helpful.
They don't acknowledge that. They don't seem to acknowledge that he might have valuable input for his treatment.
Right.
Because it doesn't seem like they respond to him. I guess eventually they do. They give in.
It seems that they are satisfied with his marginal existence.
Yeah.
And that they feel that he is satisfied in terms of their care.
Like that should be good enough.
Exactly.
You know what I've noticed is that they never mentioned recovery. Jim has no idea that recovery is possible, so I can see how that might hinder his chances of recovery happening.
Not only that, but then the tardive dyskinesia that he's starting to experience when he talks to them about that, their attitude is kind of, well, it's a good, trait. I mean, it's better for you to not have this little bit of psychosis and have a permanent disability because it's more convenient for us. And then when he finally says, you guys just aren't hearing me, and goes off his medication, instead of being able to somehow reduce it and make it more manageable, he just goes off it altogether. And then it does become a real big problem. They're not hearing what he's saying at all. They're just not into his.
And that justifies his frustration, and his frustration is essentially promulgating his desire to change.
Right.
And the dialogue that they're using, not only they're not listening, but the dialogue they're using, he argues, he's non-compliant, and all of those other things, and so they're discounting everything that he has to say, and it's, going to make it harder for him to move forward.
Right. He doesn't know how to advocate for himself, and they're not providing a method for him to be able to advocate for himself, to say what he wants and why he wants it. I mean, all they know is he wants to reduce his medication, not what is it about your life and could we help improve it in different ways.
And there's no plan to experiment or alter his treatment based on his needs.
Giving him the information to make informed decisions, or any kind of psychoeducation so that he can learn skills instead of take his medication all the time, or as much medication.
Or to involve him in cooperating with the necessary treatment that will make him feel as best he can.
And there's no way to really know if he really is being argumentative, because he's reacting in a way that any of us would react if somebody said, this is your choice. This is it.
Yeah.
And if we said, well, actually, I really don't think that is the best choice for me. And we said, you know, and they disagreed. They're disagreeing, but they're not being argumentative. But he is, because he's trying to advocate for his own life, probably not even in a terrible way, just saying, look, I really don't think that's going to be the best thing for me. And there's absolutely no option for him.
And that illustrates their attitude, I think, toward him. They don't listen to him, so they're not really giving him any credibility. They say, we are the professionals here.
Right.
We're actually giving you directions. He really has no choice, because this black and white with them is their attitude toward them. It gives him, like he's failed already.
Yeah, the sentence about what choices does he have? Is he compliance or non-compliance? There is no choice. He's compliant if he does the thing that might be wrong for him, and non-compliant if he does the thing that might be right for him.
So he has no control over his life, and so, you know, that's definitely going to cause a problem, because his choice is his life and his decision, so he'll follow through with what he decides, but
Which he did. He eventually went off meds, and then
And then they could say, I told you so.
Yeah.
And that being, it's like he has no choice at all, given the options that they provide for him. And essentially, instead of pointing out maybe alternative or things that we could try that might change both his marginal and his psychotic existences, then what kind of choice is that?
so they didn't take that in consideration. They weren't listening to him, and they also did not bring in any support at all. No collaboration with any other professionals or agencies in the area. They really did him a disservice.
They didn't see him as a person, they saw him as a mental illness.
Right, a number of the form, and this
Right.
is the
This is how
PAT
we treat that.
treatment. Yeah, this is it.
Yeah, and they didn't seem to really understand that there's a recovery process, and bring in anybody that had gone through that, and these are the medications we tried with, you know, that it didn't work, these are the ones that did work. They didn't do any of that. They didn't have any peer support at all. They just said, you know, this is what we want for you, and it's that or hospitalization, and he ended up hospitalized anyway, because they really weren't listening to his needs at all.
And also informing him, if we change your medications, this might take a while. They it didn't seem like they were eager to discuss ramifications of what he wanted. Either.
Negative or positive?
Yeah. Right.
They probably had their eye on the clock the whole time.
Could be. Well, you know, when somebody changes their medication, it can take like 3 months for it to take effect. But they talked to me here about how he started to slide back into his mental illness, but they didn't let that take 3 months. You know, they didn't try anything else that might have worked other than medication. But you know, if it's the medication that is the thing that they're going to use to fix it, then you know they can take as long as they need for that. So yeah, there was no eye on the clock when it came to the meds.
So the things that Jim, the internal things that hindered Jim from moving forward, where he probably felt like there was no hope. He felt helpless and hopeless because they weren't listening to him. They weren't helping him really, other than medication.
And to me, it's like they didn't address the range of problems that he had. I mean, to me, it's like they essentially categorized him as purely having one problem, schizophrenic, where that has all sorts of implications in terms of how he should or would or might want to conduct his life.
another internal problem would be the lack of respect. You know, he lost his, you know, dignity, and the lack of respect really, you know, probably had a major role in, you know, his inability to move forward.
Yes, and being torn down, he would lose his confidence and bring self-doubt and so forth. So maybe he wasn't confident in advocating for himself, or also didn't know what resources were out there. If he was feeling dead and living a marginal life, he probably wasn't ready to do research on his own behalf.
But
And
again,
that was when he was taking his medication as prescribed. So he probably felt really hopeless as well, because he knew what their solution was.
It made him feel marginal on Denton's side.
That's right.
And so there's no appreciation of the social aspects of what it's like to feel dead inside and what might be done to essentially alleviate it.
Looking at the 11 fundamental components of recovery, I don't see any of that in there.
Yeah.
You know, that he didn't have any of those options or support. And so I think he'd do much better with that. It would have helped.
It was really a cycle because at one time, because he went through school, he got through that, and that takes something. So at some point in time, he was just undermined, perhaps. So he lost what skills he might have had to help himself, and this feeling, whether it came from the medications or what, needed to be addressed, and it wasn't.
Yeah, well, the medications could essentially dull you to the point where you aren't able to essentially act in your best interest.
Don't care.
I'm wondering too, if there were any of the professionals that were there working with him that may have wanted something else, but because they really didn't have options either, they didn't know about all the, the other things, the peer recovery and all that stuff. Maybe they felt as upset by it as he, but what could they say? They have a solution that they know works for most people, and so I'm really wondering if, if they had been able to be forward thinking, if they would have just kind of quelled it in themselves, because the other people would just look at him and nah, that's not going to work. He may not have been the only one with the right idea.
Well, we could see how it could be improved, and maybe just creating, someone earlier talked about the wraparound services. If there would be more of a connection with the agencies or the support systems that were available along with the medical and the psychiatrist, that would be helpful for everyone.
Yeah, they do seem to be fundamentally absent in this particular case.
Well, and what supports did he have? I mean, family, church, friends. I mean, that wasn't explored at all to build on.
Well, if his life was that blank before, you're kind of getting the picture that maybe he didn't have any of that, and they weren't asking him about it either, which they should
Or
have.
they
But
were
when
participating.
when he was working on his bachelor degree, he had,
Yeah,
at least those educational supports. So there would have to be somebody else.
Yeah, what happened to those?
Yeah.
They didn't give him the skills and abilities to move forward in the community, being independent of the mental health system. They didn't.
Because you don't see anywhere where it talks about what kind of exercise are you getting, what is your diet like, what are your hobbies, what kind of
What do you like to
family,
do?
what do you like to do, anything like
How
that.
he spends any of his time.
Just
I
arguing with the
mean,
doctors.
Yes. Think of
All
that,
it describes it is as marginal.
which looks pretty bleak.
As I find it bleak, I want to adjust my medications one way or the other with those.
Right.
I'm surprised he didn't just cut his pills in half or something without consulting them, instead of just going off. I mean, I'm thinking about myself in this situation. I can be pretty argumentative at times, and I can't imagine how frustrating that would be to have a really valid point and have a lot of professionals saying, no, you're really wrong about this. I would have taken it into my own hands, which is basically what he did.
So his response was typical to the way
It
he
really
was treated.
It was typical.
And it was just unfortunate that the response engendered this reaction.
Because what he was experiencing were normal feelings and reactions to being treated like that, not necessarily his symptoms. So
Yeah, his response was justified. It was not argumentative, it was justified.
So you had an opportunity to talk about, to read the scenario here about Jim, and here's Jim, number one, and talk about what was going on with him. And now I'd kind of like to hear what you identified as some of the internal barriers for Jim's recovery, but let's start also with the external barriers. What was going on in the community or in the people around him that may have been barriers to his recovery?
Just the one-track mind. It's either medication or not medication. There wasn't an overall plan.
a one-track, one-size-fits-all, medication, no medication, that seemed to be the only option for him? Yeah. Yes. Any others observations on this? What did some of the other groups come up with?
He didn't seem to have a lot of support.
He didn't have a lot of support from people outside of him?
Exactly.
Peer support or regular support?
Any support.
Any support. Okay. So one-track mind, no support. Any other options? Any other barriers, I mean, to Jim's recovery?
There was no collaboration. It didn't seem to bring in any other agencies or any other professionals to help with Jim's case.
There was no collaboration from any other outside agencies, no community agencies to help with Jim's needs and case. Good, good. So we've identified a few things that the community could have done a little better, that wound up being barriers to his recovery. But what were some of the things, there's just one thing left that somebody hasn't said yet, that was happening there.
He didn't seem to know how to advocate for himself.
He didn't know how to advocate for
express
himself.
what he really wanted.
Right, right.
Other than he wanted to reduce the meds.
Right, that was the only thing he could think of to say was, I want to reduce the meds, but so he didn't really know how to advocate for himself, did he? Right. And Lorraine, were you going to say something different?
Yeah, they didn't ask. They didn't want to know his
They didn't
perspective.
ask what he wanted. They didn't really want to know what his perspective was.
They in fact belittled him.
They belittled him when he tried to bring it forward as
They-
best he
They
could.
said he lacks insight, and it's a side effect of the disease.
The
So,
classic, he lacks insight.
we're the professionals, we know you don't.
Yes, yes. Really, professional has the power. You have, you best you can hope for is to ask for a little bit something different. But even when he did ask, did they listen? No, right? They didn't listen. There was no vehicle for them to listen. And if they had listened, it would have really screwed up the only process they knew, which was medicine and medical model management. So listening to Jim was really difficult for them because there was no way they could give him what he wanted. Right. So those are the external barriers. And then we've already started to identify, Barbara identified some of the internal barriers. Jim didn't have the ability to speak up for himself. He didn't have the knowledge, he didn't have the confidence. But what were some of the other internal barriers that Jim was experiencing that may have been a barrier to his recovery? What were some of the internal barriers that Jim had to his recovery?
Well, I think in the scenario it talks about him feeling dead inside, which is, we don't know if that's medicationally induced or if it's just really feeling like there is no life.
Really feeling dead inside.
And I think, again, it was reinforced when in a few short days they dealt with the symptomologies of saying, this failed, you failed, we're going to put you back to this medication without dealing with this deadness.
Yes.
The internalized feeling of failure and frustration to the point that he says, no more, I'm out of here.
So Jim's internal frustration almost seems to be what was, it almost seemed to me when I first read this scenario that they wanted Jim to fail. Like he was feeling dead inside and we reduced the medicine and then he had no skills to deal with what happened, and so it's like, see, we told you. And which just increased his feeling dead inside and the frustration and the humiliation and all of that stuff that goes with that. So that then becomes, why would I ever try this again? That really feeds on the hopelessness and the helplessness that is really part and parcel of being mentally ill until we get into recovery. And then we set that aside. But
Jim had no idea that recovery was possible. No one had ever mentioned that to him.
nobody told him that he could get well. That's really true. Nobody told him he could get well. Yes. And I think it's really important, if we don't do anything else, that we tell the people that we work with, by the way, did you know you could get well? Because what happens is when people go to the doctor, the first thing they're told is, especially if they're really sick, that you will be ill the rest of your life, that you will be on medicine the rest of your life, that you can no longer go to college, that you can no longer work, that your life as you know it is over. And we never get that message. By the way, we changed our minds, right? Film at 11, you can get well. right? And that's such a powerful message.
It seems to me that the caregivers are very satisfied with the fact that he has a marginal life and him feeling dead inside, not connecting him feeling dead inside to the fact that he's able to only have a marginal life. There's other interventions that could possibly be done that would essentially improve the quality of his life that are essentially independent from his medication.
So what you're saying is that the caregivers seem perfectly satisfied with the fact that Jim has a marginal life and that he's feeling dead inside, and that it's because there's no problems with that, right? As long as he's compliant, that, you know, and I got to say this because it's true, is that people who go into provide services for those with mental illness God knows they don't do it for the money, right? God knows people are not doing, they didn't go in to become a social work for the money. They didn't go in to become a case manager or a therapist for the money.
They
so
can get a little jaundiced, though.
They can get a little jaundiced after a while. And that's the part that I hope to kind of give an infusion of some vitamin D on, is that we can kind of take that callousness. And the other piece is that, you know, if you think about that 50% of your day is doing paperwork and meeting billing codes and productivity percentages and managed care and insurance, there's such a tension there. Because in order to do what we are hopefully advocating for is to asking them to do their jobs differently. And that can be different and that can be difficult. And so it's not just about the person on the front line that needs to do it different. We have to redesign this system to allow that freedom. We have to be able to provide reimbursement for the kind of work that is going to help people get well, and not just the kind of work that we can count, and the kind of stuff that we can code, and the kind of stuff that we can chart. But we have to really step into the place where it's okay to be a little uncomfortable. But then that also speaks to accountability. We can't just start, you know, paying people to take us to the movies. Although, lately the movies have been pretty good. So it's really, what you're identifying is really a balancing act that we have to do, is that we have good people who went into this profession because they wanted to help people, and they found themselves mired in paperwork. So that's got to be a little frustrating.
And they end up warehousing.
They end up doing the best they can, and sometimes it just looks like we're just warehousing. We're just doing what we need to do to keep people from going into crisis, which becomes the symptom stabilization as opposed to life reclamation. Two totally different goals. So that's really a nice, thank you very much for bringing that up, because it gave us an opportunity to recognize that people are doing the best they can with what they've got. And sometimes it feels really frustrating for everybody. Yes. All right, so that's great. Thank you very much for that. You guys did a nice job of identifying what is it that we need to get well in this scenario. What were some of the barriers that Jim was facing? So when we talk about self-determination, which is what we were talking about, remember that little 3-year-old up there with a completely unique brain, different than anybody else's, in the environment with a community, taking authority and control? Self-determination, my favorite. In Australia, a program of education and individual involvement in treatment was introduced. And they began to involve people into developing their treatment plans. And they were able to reduce involuntary treatment by 45% in 12 months. So that's a pretty significant data set. So when we ask people what they need, we ask them what will help. When we give them the services that's going to support them, we don't have to force it. So I want to talk a little bit about empowerment, which is the next one of the components of recovery. When we talk about empowerment, it's important to talk about how unempowered or how little power people have, how vulnerable and powerless people can allow themselves to become. And so when you have somebody who's telling you that you'll never work again, that you'll never go to school again, that you shouldn't have children, when, as one of my co-trainers once said, her parents told her then husband, it's okay if you want to divorce her. We'll take care of her, right? And this was a kind thing that they were saying. This was not like mean. This was like, okay, so now you have a wife that's mentally ill, and we get if you want to divorce her. Of course he didn't. But so when you get when that kind of thing happens to you, you begin to lose your value. your personal sense of value. Who am I as a person? Am I just somebody that needs to be taken care of the rest of my life? I don't want to be that. Am I just somebody who's never going to succeed? Am I just going to bounce from pillar to post being embarrassed because I'm symptomatic? What's going to happen to me? So what I love about this particular strategy is that it's all about taking back your power. And you can do it in really small ways. What am I going to do today? There were days in my life where I had to make a list of 3 things I could do that day, and sometimes one of them was taking a shower and getting out of bed. And if I got showered and dressed and my clothes matched, it was a big win. There were some days when if I could have a coherent conversation with somebody and get through the day without looking back on it and being like, good God, I can't believe I talked for 20 minutes to that woman about my dog in the grocery store. Right? A little, you know, when those were days when I would just feel so humiliated and powerless. And little by little, as we get well, as we grow, as we go forward, as we get tools and strategies to reclaim our power, it's all about choice. It's about making a choice. It's about having a choice. What we saw with Jim was that there was no choice. It was a one-shot deal, right? We got some medicine for you. And I'm sorry, but we can't afford to have all these other things laying around. That's very expensive. So what I also love about empowerment is that it could be about self-help. One of the best things I did was after I was taking this training for a while, I kept talking about empowerment and these tools that we have, and I bought one of the workbooks, and I started working through it, right? I started actually doing this stuff, and it works. Taking control of our lives, in the areas that we need to have control in. I needed to be an effective parent. I needed to take control of that part of my life. And in order to take care of that part of my life, there were other things that had to come into place, but this was the main focus. So I got to choose what area of my life am I going to do right now. Now there are other people who may have thought that I should have focused on house cleaning. Okay, right? Not a big focus for me at that point in my life. Now, you know, I like having a clean house. It's weird, but I like having a clean house. I like the order that comes from being able to create order in my life. I make my bed every morning as a symbol that there is order in my life, right? Just a little thing that I can do, that I can take charge of, that I can make a commitment to. So when we talk about empowerment, it's a strategy that starts small and has a big bang. One of the biggest things about people that are really depressed or really disenfranchised is that they're disconnected from themselves and from others around them. And as they begin to regain their power and their authority, and they begin to not really care what the people around them think, but what do I need for my life? What do I need to be strong? What are the goals that I have? What does wellness look like for me? This may not be, you may not think I look too good, but you know what? You didn't see me 3 years ago, right? So we choose where we want to go and how are we going to get well. And that's what I love about empowerment, is that it requires tools. But it's also really hard because you have to look at yourself and you have to decide, what is it about me that needs to be fixed? And that is really hard because I like to think there is nothing about me that needs to be fixed. I mean, really, I'm pretty good looking. I'm kind of fun to hang around. I got a lot of good stuff going on for me, right? I'm okay. But really, there's a lot of stuff that needs to be fixed, and nobody wants to look at that. But when we can look at, there are tools that you can have that can make it a little less painful. And in your handouts, there's some stuff that you can look at. One of them is a mood chart. Mood charts. What? Well, you can track your moods. And you can see what's happening. And you can track and see. So if you're feeling like, oh wait, I think I see a pattern. Right? I think there might be a repeat here. This may be a cycle. And if we know it's coming, we can prepare for it. It's kind of like hurricane season, right? If you know it's coming, you can store in some water and food and freeze-dried stuff. And then attached to that also is a medication log. Now, a psychiatrist is going to love you if you show up with a medication log that says, I took my medicine as prescribed on these days, and here's what happened. Because I'm here to tell you, When you go in to see a psychiatrist and he's like, how are things going? You're like, really good. Yeah, things are going good. It's not helpful for him or her, right? It's not really helpful to tell, is this the right dose? Is this the right, is this, are you sleeping? Do you have, are you able to eat? Are you, has your sex life just completely crashed? Has, all of these things that medicine can do to us. We want to know, how is it working, right? Not only what about, your sex life and your appetite, but what about your symptoms? Are your symptoms down? Are your symptoms up? Are your symptoms the same? What symptom is it that you wanted to control? I mean, right? There might be one that you want to control, and there might be another one that you're like, well, that's all right. So by charting it, you can see, is this the right medicine or is it not the right medicine? You actually have data that you can say, this is what I did, this is what happened. And then you have a choice point. We can continue or we can adjust. The more information that you have as an individual, the more informed you are about the choices you can make. That's fabulous. And then when you provide information to your support system, then you can invite them into the decision making based on data, not based on their personal opinion or their past experience, but all of that combined with data about your actual life, because this is about you. These are some books that I think are very helpful. These are Growing Beyond Survival, a self-help and mutual support aid. Elizabeth Vermillier is the author on that. Anxiety and Phobia Workbook, Depression Workbooks, Mind Over Mood, Psychoeducation. NAMI, the National Alliance on Mental Illness, has a fabulous organization that provides lots and lots of psychoeducation. For instance, they have a family-to-family class that is a 12-week class, I believe. And you go and learn about illness, and you learn about symptoms, and you learn about medicine, and you understand what your loved one is going through. NAMI also provides a 9-week peer-to-peer class, which is where people with mental illness teach other people with mental illness coping skills for specific symptoms and medicines and illnesses, and you get to really understand what's happening to my body, what's happening to my brain, and how can I better control it. They also now have what they call NAMI Beginnings, which is a class for parents of young children that are experiencing psychiatric distress. So that's just one organization that offers a lot of classes. If you go Google whatever it is that you're looking for, I'm sure you'll find a lot of classes that are available to people, because education is what's going to help you figure out how do we move forward. What I love about workbooks is that you can pick them up and put them down at will, right? I picked up the first one on Growing Beyond Trauma, Growing Beyond Survival, and I started going through it, and I just made some realizations that it took me some time to absorb. And I just closed that book up and sat it down and went, who knew? Apparently everybody but me. So I love that about that, is that I get to choose when I pick this book up and move forward and when I don't. And what I would really suggest, again, is that we don't do this in a vacuum. Just because it's a workbook doesn't mean you have to do it alone. Just because it's self-help doesn't mean you have to do it alone. And I think that any time that you're going to be digging around inside your soul, it's always important to have an escape route, right? I think it's always important to have a professional there who has the lamp on their head so that they can show you the way out when it gets bad. So when you have, you've got a guide in that bad neighborhood of a brain that is yours, or mine anyway, there are times when I need some help sorting things out. There are people who can just say one or two things to me, and I can be like, oh, that's right, thank you. There are other times when I need to talk about stuff for a really long time. So again, I know what I need. I can help sort things through, and using these tools is just another way to kind of scrape the crud off the top and get to what's going on at the bottom and really be able to reclaim my life. There is no reason to go through the trauma of therapy other than to reclaim your life, right? Anybody who's ever been through an intake at any kind of an institution knows how traumatic that is. The trauma of the intake has to outweigh the pain of my life, or I'm not going. So we don't do that for any other reason than to reclaim our lives. We do that because there's some hope in there somewhere that things can be different. And that's why we do it. And that's why we pick up those tools. That's why we pick up those books. That's why we go to DBT therapy. That's why we read books and self-help books. And that's why sometimes we just walk away from it all and go, I need a break. And I need to go to the movies. Right? I wish I had someone to pay. Okay, so let's talk now about nonlinear. And it's very similar to when we talk about recovery as it's not a process. When we talk about recovery as not a model, it doesn't have billing codes. It's not something that someone created that they're going to roll out, that can be duplicated, that has fidelity scales and all of the rest of it. It's a process that individual humans go through. We all go through it for different things. We just happen to be talking now about what helps a person with mental illness go through this process of recovery. And it's not step A, and then comes step B, and then comes step C. It's usually first there's number 1, and then there's step X, and then there's number 24, and then there's the square root of 17, and then there's B, double B, right? So it's because it's experiential, we don't know where it's going to lead us. And that's kind of the exciting part, really. And that's also the really scary part. As we begin this journey of recovery, one of the most scariest things to face is the fact that you might get well. Because you've been told that you can't. And you become a little comfortable with that, and you become a little complacent in life because, hey, I'm never getting well. What the hey? Right? So when we begin to take that first step to actually reclaim our lives and get well, it can be really scary. And it doesn't always go in the direction we think it's going to go. And that's also part of the fear, is that what's going to get uncovered here, and can I handle whatever gets uncovered? And coming to understand that you can handle whatever gets uncovered, and that the reason it got covered was because at the time that you covered it, you couldn't handle it, but now you can, or it wouldn't get uncovered. Right? By virtue of the fact that you're able to uncover it, you can handle it. But we don't know that until we do it. So we get led in all these places that you didn't even know existed. And you get to go to all of these internal places that are really exciting and really empowering, that are spiritual, that are physical, we discover how food affects our bodies. We discover how prayer affects our souls. We discover how meditation can impact our symptoms. It's just all over the map, like who knew? So there's no way that you can say, if you go here, by noon you'll catch the train to there. Because if you go here by noon, you could be in another part of town. We just don't know. And that's part of the exciting part, and that's part of the anxiety part. That's why people hesitate. That's why people stop. Whoa, I wasn't counting on this. I thought I was just going to get well. I didn't think I was going to have to deal with my childhood abuse. I thought I was just going to get well. I didn't know I was going to have to deal with, the fact that we moved 12,000 times, or whatever happens to be going on in that person's life. So it's really important that we realize, again, it's individualized, and we have to be supportive to people and say, you know what, you may find out stuff about yourself you didn't realize. Or you may discover stuff that you always thought you were doing that you really weren't. Or you may, all of a sudden, denial falls away, and you're like, whoa, I really have been doing that for 12 years. I really have been running from relationships. I really have been, whatever it is. So it's really important that we move forward and that we continually look at the fact is that it's not direct, it's not linear, and that it's different for every person. So this is where we've come so far. As you can see, we're halfway through. So I'd like to introduce to you, first here from left to right is Terry Meldorf, and then in the center is Nancy Dow Witherby, and at the end is Jennifer Jones. So please welcome them and thank them for their participation.
Sure. Okay. My story begins as a young mother, and I had an 18-month-old baby at the time. And the depression just never went away. And the doctors told me that it was postpartum depression. So I believed them and went along with the medication regimen, and didn't have too much follow-up because it was like back in 1990, and they didn't really have very many coping skills at that time. So I pretty much just went back to work and faked it and tried to be happy, but I just wasn't. Something wasn't right. And then I began to have extreme highs and then extreme lows. So I went back to the doctor and ended up in the hospital. Didn't feel safe at that time. So then I was diagnosed with bipolar disorder 2, which that was a couple years later. And basically, it took me 15 years and all these different medications to be better. And I've had 2 more kids since then. And I was told by doctors, don't have any more children. And I have 3 great kids that don't have bipolar disorder. Therefore, it doesn't always pass along. But to become the woman that I am now, it took a lot of hard work. And I am so grateful for my family. I have a very loving and supportive family. However, when I was sick, it was really, it was pretty bad. I almost lost my children because of my self-harming behavior. My husband left me because he wasn't educated in mental illness. He didn't know that what I was going through was typical of mental illness. So he left, which made it even worse, okay, because I felt loss. So I continued with the extreme highs and lows, and altogether during my illness, I was hospitalized about 4 times. And then I started counseling after the last time. I started counseling at Columbia River Mental Health, and I got into DBT, and it made a world of difference. I started seeing things differently. I started seeing myself differently, and the doctor recommended that I get into peer support. So I did. I got back into my rhythm of a routine, and I started feeling really good. So I went up to Tacoma, Washington, and I took the training and passed the exam, which really boosted me up quite a bit. And I'm currently now working at CVAB. That's Consumer Voices Are Born, and I work as a volunteer greeter. And since I've been working at CVAB, I've accomplished a lot. I took the warm line training and passed that, so I've got my certificate in the warm line training, which I'm going to start doing that pretty soon, which I'm really looking forward to. And my kids, if I'm not feeling good, my kids give me verification that I'm doing okay. Because when I'm not feeling good, they act out on it, and then I know that I'm not feeling good. And they let me know. We have good communication. I have a 13, 15, and 20-year-old, and we all have really good communication about when mom's not feeling well. And my husband kind of takes control because he got educated. He went to counseling with me. He took some classes. He read some books. He got online. He read a lot about bipolar. And now things couldn't be better. We bought a big house, and all my 3 children live with me, and then my grandson lives with me too. And sometimes it gets hectic, but however, I'm doing okay because of self-care. I remember to take care of myself, and I don't know, I love recovery. Recovery really does rock. And that's my story. Thanks, thank you.
This never happens, but it did. My story started when I was 16. I started going through periods of depression, and I got through high school, I got through college, I kind of went out in the world. Went altogether 20 years not being diagnosed correctly. I am also bipolar 2. And for me, the trauma was the length of time that I tried to find out what was going on with me. I took literally every antidepressant that was ever put on the market during that period of time. I went through more intakes and more psychological testing because that was the days of fee-for-service, and you take your life in your hands now asking me to do an intake or go through any kind of assessment testing. I was married twice. I had a child. I finally, after pretty close to this 20-year period of time that I'm talking about, I just got angry. The other thing that complicated it is I was reverse seasonal. So I would go down in the spring, be down all through the summer, and come back when there was no daylight. So that was another thing that confused people through the process of diagnosing me. But I started going down in May once more, and I went to my medical doctor and asked him to run every test that could possibly be causing me to start sleeping more, low energy, just down, down, down. Everything came back normal. I went to a therapist that I had seen at another point in my life, and I'd been to many of them, who pulled out one of the many psychological tests on me and said, if you're bipolar, it's kind of beyond me because of the symptoms. And he sent me to a psychiatrist who diagnosed me as bipolar 2, said this is preliminary, pending the results of you taking mood stabilizing medication. I responded in 3 days. And I had been going through 5 to 6 month long depressions every year since I was 16 and I was 36. In that period of time, I learned to break every part of life down into incremental tasks. And that's a good skill to have. And I learned to not take on real big challenges. There's, at some level, I knew even during the period of time that I was up, which for me was not extreme highs. It was the cycles came on very slowly, very incrementally, and so up was really basically normal for me, and down was about as far down as it goes. The skills I learned when I was incapacitated for so long have really served me well in terms of learning how to break things up into manageable tasks. I'm not someone who resisted getting a diagnosis or being put on medications. My reaction was, there's a name for this, there's a treatment for this, bring it on, I'm cool. I got a degree in psychology in 1977 and never did anything with it. In 1998, I went through the consumer to provider program that was in place then. That was the original version of what led to the peer counselor training program. I went through the consumer to provider program. I went to work at Harborview as a peer counselor, and I've never looked back. I've been there for 11 years. I absolutely love what I do. There are times when I say, gee, I get to do all this and they pay me too. My life is completely different. I attended this class a number of years ago because I hit the point where I wanted to be able to train. I wanted to be able to work with people, and I hadn't been able to do that up till now. I still take kind of quantum leaps in terms of the challenges that I'm willing to take on. Life now is unbelievably different than it was when I was younger. It took me many years to realize that there are massive holes in my memory from that period of time, that I'll remember people's faces but not connect names or circumstances, or I'll remember circumstances but not names. And it's something that took me a long time to realize. There's holes in what I remember experiencing because there were holes in me during that period of time. I feel very grateful for the lessons that I learned. I wish I could have learned them in a shorter period of time than I did, but they're all things that have been real helpful. I had an interesting example of stigma still continues just recently. My mother passed away, and I was in Michigan with my family, and all of a sudden I realized that everybody was watching me very carefully. The whole family was grieving, but they were watching me very carefully. And I realized that it was I going to fall apart? And that wasn't the nature of my illness even then. When I got very down, I didn't fall apart. That took too much emotional energy to be able to do that. I was very, very stilted, and I basically felt like I was numb. I felt like I was awake but anesthetized. I realized I was very comfortable, that nobody's comfortable when their parent dies, but that I didn't feel at all unstable, and it was kind of interesting to have people watching me, and that was a lesson that stigma's still out there, that people expected my reaction to be different from the rest of my family. I have a daughter. She is not bipolar. She is a computer scientist, and she's 29, and she's beautiful, and life is good. Thank you.
So, I just want to mention that I'm a person first. You know, I have chronic mental illness. My name is Terry Meldorf. You know, I grew up in a single-parent home with, I believe my mother had some undiagnosed mental illness. And then I noticed, in retrospect, I look back, I noticed that, you know, maybe my behaviors in school may have been, you know, a mental health issue. Later in life, I had a really good job, a promising career. You know, I was very independent, and then I noticed some changes, and I knew something was wrong, and I started to self-medicate, and eventually I lost everything, everything that I'd taken for granted. You know, all of my hopes, all of my dreams. Later, I knew something was wrong and I needed to do something about it. I tried to go to welfare and I was too sick. I couldn't comprehend what they were saying. I didn't understand the paperwork, and I would just get overwhelmed and I would leave. Later, after not getting any support and not getting any help, I ended up assaulting someone. I became homeless. At this point, I had a 2-year-old son, and so I was desperate. The courts gave me 2 years of mental health instead of anger management because they could see that something was wrong. Then I started therapy. And then after I was in therapy, I started drug treatment. And at that point, I'd been clean 30 days, and I moved into Y housing, which is transitional housing for the community. And because of the resources that were available, you know, and that was when I really started my recovery. I started Clearview. I started to go to Clearview Employment Services. And I remember when I went to my orientation, I had less than 30 days clean and sober. I was sanctioned on welfare. I didn't have a bus pass. I was pushing around a little 50-pound 2-year-old that could walk but wouldn't walk. So every time I let go, he would walk away in the stroller. And I was having to walk to all of my appointments, and so I violated my probation. And so I was looking at going to jail, losing my son, and losing my housing. And so Clearview helped me to put a wrap around. And so we brought all of these different providers together in one place. It was my, because I had so many unrealistic expectations, and no matter how hard I tried, and no matter what I did, I could not do it. And when I was trying to communicate with these people, you know, I was angry, I was frustrated, and of course, you know, I would want to give up, and so I would fail, and unfortunately, sometimes when you're reacting like that, there's a negative response, and so I was not able to communicate with these people. So what we did is we brought them all together to show them all of these unrealistic expectations. So there was my transitional case manager, my TANF worker, my social worker, my probation officer, my mental health case manager, my drug and alcohol counselor, my son's DD case manager, because he had some DD issues, he has, and my vocational specialist and myself. And we brought them all together and we showed them all of these unrealistic expectations. And I really believe that that meeting was the beginning of my recovery, because I was able to communicate with these people on a completely different level. I was able to be treated with respect and regain my dignity. You know, instead of being the victim and having all of these different things, I was able to explain to them. Not only were they there, but the people that were supporting me. And so I was able to get off sanction so that I could get a bus pass back. They didn't violate me, so I didn't go to jail, so I didn't lose my son, so I didn't lose my housing. And I'm not going to tell you that that meeting was like, oh, everything is better, I'm going to succeed, you know, for a couple of different reasons. One, there's good and bad people everywhere you go. And there were still the providers there that were rude and disrespectful and non-supportive and made it impossible for me to try to succeed. At least that's how I felt. And so I was able, instead of being the victim, I was able to go to their supervisor. Well, first ask them, look, I'm going to succeed with or without your help. I would like it to be with your help. If that didn't work, I was able to go to their supervisor and say, you know, I'm having a hard time communicating with this person. Instead of telling their supervisor what kind of a person they were or what I thought, I was able to talk to their supervisor and ask for someone new. And then, you know, by doing that, I was able to get the support I needed so that I could move forward. And so, you know, that made a huge difference in my life. You know, I still struggled with getting to my appointments, you know, because I'm considered to have chronic mental illness, multiple diagnoses, you know, but I have symptoms, I have issues, as Mary would say. I've learned over the years from Mary, I have issues, and more then than I do now, you know, because life changes, as we've talked about. But I was able to eventually work through those things. And you got to remember, all of these different places had different requirements. And so, you know, we were able to stagger things. I was able to get there on the bus. It was an amazing, you know, step in my recovery. Now, I'd mentioned Clearview. Now, Clearview is a supported employment program through Columbia River Mental Health. And I was assigned a vocational specialist, and she's the one that helped me put that together. But you got to remember that she supported me, but it was my responsibility to, you know, learn how to communicate with these people. After doing that, there's something called a rally. And what that is you bring the people that are supporting you. I brought my therapist and my transitional case manager and my vocational specialist, and all together. And a rally is, you draw a picture of your life. And, you know, like where I grew up, where I went to school, you know, the challenges I had in my life, you know, the things that I'd faced, you know, where I'd gone, where I'd come from, you know, where I went to work, where I'd ended up, and the things that had gotten me there, you know. And there were things that I was ashamed of, embarrassed about. You know, it was difficult to go through that, you know, like we were talking about an intake, you know, going through all of that. But my therapist and my case manager and my transitional housing case manager learned more about me than my therapist had in, 2 years.
you know, in that short amount of time. You know, to me, they were things that I'd overcome, strengths that I'd had, you know, and gave me, you know, the ability to move forward, because it gave me direction, because, you know, and then I started thinking, you know, what do I want to do? Because this is my life. And so I decided that I wanted to be a peer parent partner, you know, which is the same as a peer support specialist, except it's a parent or guardian of a child with a mental health issue, which by then my son had started to develop, you know. And so, but there was a point in my illness that I really hadn't left my house in about 5 years. And so it was baby steps for me. So at first it was volunteering once a month, then it was like 1 week and, you know, 1 hour a week. Then it was starting to, you know, volunteer for 4 hours a week. You know, learning how to, you know, take steps and get out into the community and build those social skills, because, you know, I wasn't the same person. I'd lost that person. I had to mourn my issues. I had to mourn the loss. I had to mourn what I could have done if I didn't get sick, you know, but in doing that, I realized what I needed to do. And so I learned all those, you know, skills slowly and surely, and, you know, and it was a lot of hard work, but, you know, it was my life. So I lost a page. So, oh no, good thing it's my life. So, I thought I was losing it. So, you know, working with Clearview made it possible for me to, that's nice, made it possible for me to have all kinds of different opportunities. You know, now my vocational specialist supported me, but she didn't enable me. She gave me support that I'd never had before. You know, and in doing that, I started becoming, you know, part of the community, building my supports, building my networks, and going to so many different trainings. Parent education leadership training. One of the biggest trainings that I went to when I was in recovery was the Community Empowerment Project. It was ongoing trainings that were all free, and they taught me so much. And then I, you know, learned how to be a completely different person and be a good mother. And so my first job, I ended up being a peer parent partner with the county. My office was in my home. I worked about 20 hours a month, and it was a really good step for me, you know, and it was a healing process because I was able to share what I had with other people. Eventually, I got another job. I became a disaster outreach for Hurricane Katrina, and then I got my job at Columbia River Mental Health as a peer support specialist at Clearview. So, you know, I've really changed a lot, but you know, there were so many things that I had to do, you know, without my spirituality and without the 12-step program, you know, the psychoeducation, so that I could learn about my illness, so that I could learn about my symptoms, so that I could identify them. Like Mary was saying, it doesn't help. You know, this is going on right now, but you know, and what I can tell you is that my recovery is fluid. It is never ending and always changing, you know, rapids, ice, streams, you know, and I don't know what's next, you know, but I'm sure it'll be as wonderful as the changes that, you know, I have now. I have several accomplishments. that I seem to have lost. But, but, you know, now I share my recovery with people, you know, to instill hope and show them recovery is possible. You know, and not only do I share my journey with the people I work with, meaning the consumers, but my coworkers in the community to fight the stigma, you know, so, you know, they know that recovery is possible, you know, because I am no different than anyone sitting in this room. You know, we're all the same, and you know, I've had the opportunity to have my story published in the American Journal for Psychiatric Rehabilitation. I've shared my story in Washington, D.C. I've spoken in different work groups at the Behavioral Health Conference and at the Mental Health Advisory Board. I was a stakeholder for the Homeless Vocational Grant in Clark County. I consulted with the VA to start their peer support program. Those are the jobs I had. And I've had an opportunity to support people in moving forward with their recovery, you know, instilling that recovery, you know, is possible. You know, I have to say it twice because it's so important to me, you know. And so I'm really proud of where I've come from because it would make me the person I am, but without the 10 or 11 fundamental components of recovery, I wouldn't have made it. But it's nice to see them because it kind of validates the things that I've had to do to move forward. So, thank you.
Thank you all very much. Thank you very much. What I'd like to do now is to take, do you have any questions for the panel members, and then we'll go to lunch.
So the first person, I was wondering about warm line,
what is a warm line?
Oh, okay. I should have brought cards because I could have given you cards, but the warm line is a peer support based phone number that you can call if you're having a tough time. It's not for crisis, because crisis, there's a separate line for crisis, but if you're a person that's just having a hard time and just wants to talk, you can call Warm Line every night between 5 and 10.
You get, you know, hotline versus warm line. Get it?
Yeah, you're welcome.
Any other questions?
I'm just wondering, when the point of time when you realized you needed help, where did you go first? How did you know where to go to get help?
So when you realized that you needed help, how did you know where to go? Is that directed at any one person?
Either
any all.
Well, for me, I was out of it. I don't remember a lot of, like her, I've got holes in my past because I wasn't there. So my family, it was my family that decided that, Jen, you probably need to go into the hospital and get some help. So that's what I did. I had family behind me.
In my case, I was still a teenager. I was still a minor, and so that process started when I was still at home.
For me, I'd recognized my behavior because of my mother, and then the courts helped direct me in the direction they definitely helped. But you know, I knew there was something wrong. So.
Any other questions?